Bismillahirrahmanirrahim. I am Dr. Abdus Sattar Chowdhury, Physiology Department, Awmc Medical College. Today my topics is micturition. First, what is micturition? Micturition is the process by which the urinary bladder empties when it becomes filled. It has two steps. One is filling of the bladder. Second step is the emptying of the bladder. Filling of the bladder is might be called storage of the bladder. Then emptying of the bladder is called evacuation of the bladder. What is filling phase? Filling phase, as you know, the urine is formed in the kidney, and then it transports through the ureter to the bladder. Then it is collected in the urinary bladder. It is called filling phase. When the bladder is full enough, when the threshold above the level, then micturition will start. That micturition is the nervous reflex. That is called micturition reflex. Micturition reflex is the automatic spinal cord reflex, and it is inhibited and facilitated by the upper center. These are called micturition. Now, I'll discuss about some anatomy of bladder, physiology, anatomy of bladder. This is, the bladder having two parts. One is body, another is neck of the bladder. Body muscle is called detrosal muscles. And neck of the bladder, the detrosal muscles, the fibers of the muscle descend on either side of the neck, then it continues with the posterior part of the urethra. Then when the detrosal muscle is contracted, then micturition will occur. Now, innervation of the bladder, that is nerve supply of the bladder. There are three types of nerve. One is parasympathetic, sympathetic, and somatic nerve. Parasympathetic nerve that supply to bladder is called pelvic nerves. It carries both sensory as well as motor, and it derives from sacral part of the spinal cord, that is sacral 2, 3, 4. Then sympathetic nerve, its name is hypogastric nerve. It derived from number 2. And another is somatic nerve. The somatic nerve name is pudendal nerve. It derives from sacral 2, 3, 4 of the spinal cord. That is supplied the external urethral orifice. Now, these are the nerve supply. What is the function of parasympathetic nerve? Parasympathetic nerve is responsible for the micturition reflex. Then what is the function of sympathetic nerve? Sympathetic nerve has having very minor role. It supplies the neck of the bladder. That is internal urethral orifice, and it has some minor role that when the bladder is very full, it is feel tense, and some pain will carry through the sympathetic nerve. Somatic nerve, that is, it supplies the external urethral orifice. That is responsible when the micturition, it causes relaxation of external sphincter. As you know, when the urine is stored in the bladder progressively, that the tension on its wall goes high. When it goes above the threshold level, the micturition reflex starts. During micturition reflex, then urinary bladder muscle, detrosal muscle, will contracted. That forces the urine towards the neck of the bladder. When the neck of the bladder is extended or distended with urine, then strong micturition reflex will occur, and that causes the contraction of the abdominal muscle, that increase the intravesicular pressure, and relaxation of perineum and relaxation external urethral orifice, then micturition occurs. These are the mechanism of micturition. Now, what are the abnormalities of micturition? Usually there are three types of abnormalities. One is atonic bladder and incontinence. Another is automatic bladder. Third one is neurogenic bladder. Now the atonic bladder, in this place the spinal nerve, that is dorsal root of the spinal nerve, is interrupted. As a result, the signal is not coming from periphery to bladder. There, when the bladder is filled up full enough, then some urine will debris into the urethra. That is called incontinence. That is called overflow incontinence. And in this place, there is periodic evacuation of bladder is not possible. When the bladder is fully distended, then micturition reflex will occur. That is, evacuation of bladder occurs. The cause of this disease, cause of this atonic bladder, is central nervous system syphilis. That is neurosyphilis. Neurosyphilis is one of the cause of atonic bladder. Another is crush injury of the sacral region of the spinal cord. This causes, in neurosyphilis, it causes a fibrous tissue which encircles the dorsal root of the spinal cord. As a result, the signal, that is sensory signal, will be interrupted, and that bladder is called diabetic bladder, and the disease is called tabes dorsalis. Second one is automatic bladder. Automatic bladder, it is when the spinal cord is transected above the sacral region. In this place, some inhibitory signal as well as facility signal that derived from upper center has been lost. For few days, there is a depression of micturition, and after few days, if the evacuation of the bladder is done by catheterization, then micturition reflex will recur. That is called Micturition reflex. That type of bladder, the bladder will be not completely evacuated. Third one is neurogenic bladder. That is, in this place, there is from higher center, the inhibitory impulse is interrupted. Therefore, the micturition center always excited. Therefore, a small amount of urine when accumulated in the bladder, usually causes urination. That is called neurogenic bladder, and frequently use of washroom, that is called neurogenic bladder. I think this is enough for you, my dear student. Next time I will give you all details. It is the short things. Thank you, sir. Assalamu alaikum wa rahmatullahi wa barakatuh.